What should I ask my care team about my bone cancer pathology report? When you receive your pathology report for bone cancer, it can feel overwhelming. Asking clear and specific questions helps you understand your diagnosis and treatment options better. First, ask exactly what type of bone cancer you have. Is it osteosarcoma, Ewing sarcoma, or another type? Knowing whether it is a primary tumor or a secondary cancer that's spread from elsewhere is also important. This classification guides your treatment plan. Next, ask about the grade of the tumor. The grade shows how abnormal the cancer cells look under the microscope and how quickly they might grow or spread. Tumors are usually graded from low to high. Higher grade tumors tend to grow faster and may need more aggressive treatment. Understanding this helps you grasp the seriousness of your condition. It is also crucial to find out the stage of your cancer. Staging tells you how large the tumor is and whether it has spread to nearby tissues, lymph nodes, or other parts of the body. This information is key to understanding your prognosis and choosing the best treatment options. Ask about the percentage of tumor necrosis if you had chemotherapy before surgery. Necrosis means dead cancer cells. A higher percentage of necrosis usually indicates a good response to treatment and can influence future therapy decisions. Knowing this helps your team plan the next steps. Make sure to ask if the surgical margins were clear. Clear margins mean the tumor was completely removed, with no cancer cells at the edges of the tissue. If margins are positive or close, additional surgery or treatments might be needed to prevent recurrence. Inquire whether the cancer has spread to lymph nodes or other tissues. Bone cancers rarely spread to lymph nodes, but if they were examined, ask about their status. Also, check if there is evidence of metastasis to other parts of the body, as this impacts staging and treatment. Ask if your report mentions any precursor lesions or other notable features. Sometimes, the pathology might reveal conditions that could influence your prognosis or treatment approach. Find out if any special tests were performed, such as immunohistochemistry, molecular, or genetic testing. These tests can help classify the tumor more precisely and identify potential targets for therapy. It is also wise to ask about the certainty of your diagnosis. Bone tumor diagnosis can be complex, so ask if additional biopsies or expert consultations are recommended to confirm the findings. Finally, ask how your pathology report influences your treatment plan. Request an explanation of how the specific findings, like tumor type, grade, and stage, will guide your options for surgery, chemotherapy, radiation, or participation in clinical trials. Understanding these details from your pathology report empowers you to communicate effectively with your care team. Always discuss any terms or results you find confusing with your healthcare providers to ensure you have a clear, accurate understanding tailored to your individual situation. Remember, every case is unique, and your medical team is there to guide you through this process with personalized advice.